Tonight on Primetime Politics, cracking down on public drug use.
Does he believe that people should be allowed to smoke meth or crack in children's soccer fields?
Once again, we see the leader of the opposition trying to score cheap political points.
Ottawa approves BC's request to recriminalize the use of drugs in public spaces, scaling back a pilot project that allows for the possession of some illicit drugs like cocaine and meth. Coming up, we'll get reaction from MPs and hear why Conservatives would rather the program was ended altogether. Also, Stormy Daniels, the adult film star who was allegedly paid hush money by the Donald Trump campaign, testifies in court. This is Primetime Politics. Hello, everyone. I'm Michael Serapio. Well, Ottawa is answering British Columbia's call, announcing today that it will allow the province to scale back a pilot program that decriminalizes small amounts of heroin, cocaine, methamphetamine, and fentanyl. With this approval, it means BC can once again make it illegal to use those drugs in public spaces, but that does not end the debate.
So he refuses to rule out repeating this disastrous experiment that killed 2,500 British Columbians. It's because he strongly supports decriminalization, and if he got a chance, he would do it all over again in Toronto, in Montreal, and anywhere else. Mr. Speaker, the final question, therefore, is even the radical NDP government in BC asked for him to reverse his decriminalization. Why did it take him 10 days and 66 more deaths to do it?
Here. The Right Honourable Prime Minister.
Once again, Mr. Speaker, we see the extent to which the leader of the opposition will make political attacks on the backs of the most vulnerable people in this country.
That's right.
We actually only received the completed request from British Columbia Friday last week and approved it the following Monday, 3 days later, Mr. Speaker. We will always respond quickly in a science-based way when people's lives are on the line. The leader of the opposition is continuing to spread falsehoods, Mr. Speaker, instead of actually following the facts and caring for Canadians.
Well, with their thoughts on the debate and Ottawa's decision, we're now joined by Taleeb Noormohamed, the Parliamentary Secretary to the Heritage Minister, Melissa Lantsman, the Deputy Conservative Leader, and Gord Johns, the NDP critic for mental health and harm reduction. Hello to all three of you.
Hi.
Hello. Mr. Noormohamed, I'll get you to start us off here because, you know, not only are you a Parliamentary Secretary, but you're also a Vancouver area MP. I hear the Prime Minister say that it was only last Friday that the full paperwork was submitted. But as you know, the province, your province, was asking for this scale back a week before that. So how will you explain that delayed timeline to the voters in your riding?
I think, first of all, it's important to note what exactly this is about. This is about a pilot project that the NDP government asked for several months ago. We acceded to that request. They asked for that to be amended. We've acceded to that request, and it's very important to understand that when they made the request, the specifics of the request were received on Friday. That's what we were responding to. And so now the real issue is to make sure that in this conversation we use a science-based, fact-based approach rather than misrepresenting the facts. The fact is that this program was put in place to save lives. The effort was made by the province of British Columbia. Now, there were other things that were needed to be done alongside the decisions that were made around treatment, all of those different important pillars. But the fact is that the reason for this was to make sure that the fentanyl deaths that were happening as a result of unsafe drugs in people's hands, that those were mitigated. The reality is that you can't help people who have already died. And so the objective of this program, as the BC government requested and noted, was to try and save lives. They have recognized that there are challenges. They came to us with this request. That request has been met.
Ms. Lantsman, what do you say to that? Because, you know, I hear your party hit the federal government on this one hard, but at the end of the day, this is a program that BC, as a provincial government, wanted to try out with the intent of saving lives.
This is an ideological crusade by this government to legalize smoking crack, smoking meth, shooting up in playgrounds, in public places. It is responsible for the death of 2,500 British Columbians last year, 40,000 since this government came into place. This will go down as one of the most insane policies that the government enthusiastically supported and then waited 11 days with some weird explanation about when paperwork was done to turn back. Even the radical NDP in BC decided that this was too radical for them, and the Prime Minister today could not disavow decriminalization. So we want to know what he believes and what he's going to do next and where.
Mr. Johns, what's your take of it? Because you have the two sides right there beside you. On the one hand, arguing that this is for an effort to save lives. The other saying that it just doesn't make sense if you want to save lives.
Well, first of all, my heart goes out to all the victims and the families of the loved ones that have died to this tragic crisis. And as we know, in a health crisis, incrementalism costs lives, and the Liberals have taken a slow approach in terms of responding to this health emergency. They still haven't declared a national public health emergency. The Conservatives' disinformation also costs lives. I mean, it's completely false that decriminalization is the cause of the toxic drug crisis or the reason people are dying. We've heard from police that they wanted some tools to be able to deal with public drug use, but they also said that criminalizing people causes more harm and they don't want to go back to it. We can look to Alberta, where they don't have decriminalization, where they don't have a safer supply. Now, you know, as of today, when we saw the release of the BC Coroner's report, that Alberta now has the highest death rate per capita in the country. In fact, Lethbridge is triple that of British Columbia, and they don't have decriminalization. They don't have safer supply. The things that the Conservatives like to cite when they point to the reason people are dying. They're dying from poison drugs manufactured by organized crime. That is according to the police, to health officials, and this disinformation is harmful. It creates more stigma. And it creates a lot of hurt to the families of the loved ones, when in fact we need to come together, we need to declare a public health emergency and have a robust debate how we move forward together as a nation in the middle of this health crisis.
I think it's important to note, Michael, that when this policy was requested by the government of British Columbia, it was in partnership with the City of Vancouver, local police, local law enforcement who came forward and said, we support this. So when our government looked at that request, we made the evidence-based, science-based decision. And as Gord rightly pointed out, if you look at the magnitude, the quantum of deaths in a place like Alberta and the Conservative government, the far-right Conservative government in Alberta, and Saskatchewan, the lives that are being lost there without any openness to looking at ways to save lives, that speaks volumes for what a Poilievre government would do, which is frankly to put at risk more and more and more Canadians and play politics with people's lives. We're not going to do that. I think it's really important for Canadians to understand the rationale for doing this, the rationale for pulling it back, and the urgent need to look at treatment of addictions, to look at safe supply, to look at all of the elements and tools available in our arsenal to make the right decisions in a four pillars approach to saving lives.
Michael, why don't you let me tell you what a Pierre Poilievre government do? We will ban hard drugs. We will ban smoking crack in a hospital room. We will ban shooting up in a playground next to schools. And we will ensure that those who are affected by addiction get the treatment that they need. We have two parties here arguing still that decriminalization is the way forward, that these kinds of insane programs are the way forward. And we want to make sure that
Melissa,
they
it's
both
hard to support healthcare when you keep cutting funding for it. You keep voting against it.
They both tell us that they won't do this elsewhere, that they wouldn't do this in Toronto, that they wouldn't do this in Montreal. We have the right to know, and Canadians have the right to know, whether they believe in decriminalization or not. We hear that Gord absolutely does, and we haven't heard the Liberals disavow legalization and their failed experiment, which has killed thousands of people and diverted drugs. It kills thousands every year, and it kills 6 people a day. It took them 11 days to tell Canadians that this was not a plan that they were going to go forward, and they still can't say that it's not something that they're going to go forward with in Toronto, in Montreal, in Halifax, and anywhere else that asks.
But Ms. Lantsman, if and this is picking up on what we heard from Mr. Johns there, if the Vancouver police are in favor of trying a pilot program, if the city, the provinces, why not allow them to try to save lives best they can by trying something different rather than just the status quo?
The pilot program has failed. Even the radical NDP BC government, who has been for this, has come crawling for to ask the Liberals to go back on this failed experiment. We want to know if the federal government is in favor of decriminalization. It's clear that the answer is yes, because it's not no, and we want to know that if they're going to expand this program to places like Toronto and Montreal. Canadians have a right to know that.
Mr. Noormohamed, how would you answer that question? Is the government prepared to expand this program and try other pilots?
Well, Ms. Lantsman is entitled to her opinions, but not to her own facts. What are the facts? The facts are the province of British Columbia, alongside the city of Vancouver and the VPD and other law enforcement, came forward and said, we would like to try this. We reviewed the application. We accepted their request. They came back and said, look, this isn't working in the form that it's in right now. We said, that's what you want. We will accede to that request, and we will grant the request that you've got. Those are the facts. We are a science-based, evidence-based government. When provincial governments come to us, regardless of their political stripe, with things that they would like to try to save lives, we are going to assess those and evaluate them on their merits. Ms. Lantsman can make up whatever narrative she would like. That's up to her. But the facts are the facts, and what we have done and what we will continue to do is to do everything that we can in our power to save lives.
That's really
you are open. You are open. Well, you are open then as a government to try this pilot elsewhere.
What we have said, and what we will continue to say, is if there are means that are brought forward that are evidence-based, with the backing of the relevant authorities, with the backing of the relevant data, that show that we can save lives in this urgent moment in our history where people are dying from toxic drugs, we should be open to looking at what the science says, not making ideological decisions.
I hear the word urgency, and again, back to urgency. What we're not seeing from this federal government is treating this as a health emergency. They've spent less than 1% of resources that they applied to COVID-19, yet we've lost more lives in my home province of British Columbia. The province of BC is looking for a federal partner. We can look at what the Conservatives will do when we look to Alberta and Saskatchewan, where it's a disaster. The death rates from toxic drugs are skyrocketing. Their single-focus policies are a complete failure. And we look at even north to Alaska, their death rates grew 45%, a Republican state, last year. And that isn't a state that has safe supply or harm reduction or decriminalization. So we've got to get away from this fallacy that British Columbia's decriminalization policy or safe supply is responsible for what's happening. What we need is to scale up rapidly treatment on demand, prevention, recovery, education, and we need to stop criminalizing people for using substances, something we've heard loud and clear from both the police and from health professionals, and we need to listen to them. We know the Conservatives don't believe in evidence, and they don't believe in listening to the experts.
But Mr. Johns, how do you respond then to the point that was being made by Ms. Lantsman here, that British Columbia itself is pointing to a failure and as a result is scaling back? Does that not point to underlying problems with this program overall?
I think with a trial, you have to listen to the public and you have to be willing to adjust. They heard loud and clear from the police that they needed to make sure that they had tools to move people along. But they said only in extraordinary circumstances would they arrest people. They also unequivocally clear they do not believe criminalizing people who use substances will help. They said those days are gone. Quote right from the president of the BC Chiefs of Police. We need to listen to them. And what we're doing is encouraging the provincial government, the federal government to do just that. But Alberta and Saskatchewan, they don't want to listen to anybody. Their single focus is costing lives. Look at Lethbridge. They closed safe consumption sites, and now their death rates are triple that of British Columbia. What we need is the federal government to get on board, open more safe consumption sites. That's a call to action by the Chiefs of Police, by the way, to make sure that people don't die when they're using substances and they use them safely. And we've only had one death in over a decade of safe consumption sites. So we know that they're important, but they're also an important tool so that people aren't using in public, especially people that are marginalized or homeless.
Ms. Lantsman, is there a danger here that your party is leaning in too much on criminal law and not focusing enough on a health issue?
Look, I think that it's very clear, and Canadians have been very clear. British Columbians have been very clear. It's exactly the reason why the BC government asked this government to stop their insane project. People are dying. There are needles in soccer fields being picked up by parents before their kids play. There is meth being smoked and blown in the face of nurses in hospitals, which does not happen in Thornhill. It happened in BC because you gave them a carve-out to allow that to happen. I'm sitting between two politicians that want to see more taxpayer drugs, which we know have been diverted. We know that the Vancouver police, the 50% of what they've seized from safe supply, or unsafe supply as we would call it, are from the hands of diverted drugs that end up in schools with young people.
Said pharmaceuticals
this is an insane
nominal in what they're getting on the street.
And I think that both of these MPs who want to see decriminalization go forward are going to pay for it when they have to explain that to their constituents, who clearly want to see something else.
The police have been unequivocally clear that the diversion of safer supply is not what's killing people. It is toxic fentanyl. They've repeated that over and over again, that pharmaceuticals is nominal at best and hydromorphone is just a fraction of that, never mind diversion of that.
To sit here and say that diversion is okay in the schools and with young people who are now getting addicted to drugs,
but
I think that is a warped view.
Well, this is exactly the Conservatives fail to listen to the experts. Even the Law and Order Party will refuse to listen to the police themselves.
I go back to. For those of you that are watching this show, I would encourage you to read what Ben Perrin, who was a senior advisor to Stephen Harper, had to say. Ben is one of the strongest advocates for taking the approach that says, first of all, don't criminalize addiction. Don't treat people who have a health crisis, who have a health challenge, as criminals. He has been out there advocating for an intelligent, thoughtful approach. Now, what we did is we looked at BC's approach, BC's request. We agreed to that request. They came back and said there are challenges. We want this to be changed. We accepted their request. What we have to be asking ourselves as a country is, are we prepared to do things to save people's lives? Are we prepared to look at science?
Let me jump in. I'm sorry to interrupt, but quickly running out of time. Yeah. You know, we have less than a minute here, so I want to go down the line here, beginning with you, Mr. Noormohamed. What do you want Canadians to do right now? Exercise patience, be more critical. At this point in the debate, what do you want Canadians to do in reaction to this?
I think it's very simple. I think Canadians need to look at the facts. The facts are that BC made a request. We acceded to that request. They came back. They said the pilot program that they had designed didn't work as well as they would have liked. They wanted us to pull back from that. They wanted our permission to pull back. We've granted that. But what I would like Canadians to be able to do is to think about all of the tools available in our arsenal to deal with the opioid crisis, to think about the question of how we address tainted drugs, all of the challenges that we are seeing. And that's why we've put money forward to support law enforcement in this effort. That's why we've put money forward into the healthcare system. And we're going to keep working with provinces who, by the way, are the jurisdiction responsible for these challenges, to work with them to ensure that we are saving lives across the way. Regardless of political party, we have to be looking at the important work of saving lives and ensuring public safety at the same time.
And Ms. Lantsman, same question to you.
Well, we are going to advocate for no taxpayer-funded drugs that end up in the hands of those who abuse them, and we want to make sure that those who are afflicted by addiction get the treatment that they need and not more taxpayer-funded drugs. We want to hear from the Liberals an unequivocal denunciation of the failed decriminalization policy, of the failed legalization of smoking crack and meth in hospital rooms and finding needles because people are shooting up in parks next to kids. It's very simple. Are you against it? And if you're not against it, when are you going to approve it for Toronto, for Montreal, for Halifax, and for anyone that asks? They should be able to. It's a simple yes or no question. And what we didn't hear on the panel today is that.
Okay. And Mr. Johns, final word to you.
Well, it's a health issue, and they need to declare a national public health emergency. They need to rapidly work with the provinces and territories and scale up treatment on demand, prevention, education, recovery, and scaling up safer supply of substances and stop criminalizing people. Also, they need to reinstate the expert task force to give the government expert advice, oversight, and accountability. And lastly, have a First Minister's meeting. We had an auto theft summit, but we haven't had a summit on one of the most deadly health crises in the history of our country. It's actually unbelievable. Not saying that auto theft isn't an important issue, but this is clearly a much more important issue to all Canadians.
Okay, well, that is the time that we have. Taleeb Noormohamed, Melissa Lantsman, Gord Johns, thank you very much for the time.
Thank you.
Well, time now for a look at what else happened in politics today. Starting in Montreal, where India's High Commissioner spoke today, noting that the relationship between Canada and India has many positives and that there are discussions happening behind closed doors to address current tensions. But he, like New Delhi, is concerned about debates happening in this country that would affect the future of his.
My concern is national security, threats emanating from the land of Canada. These threats are largely emanating from the Canadian citizens. So these two are my red lines. We are ready to sit down on the table any day, and we are doing that, and we are trying to resolve this issue.
The High Commissioner's remarks come just days after the arrest of 3 Indian nationals, all of whom are charged in the murder of Sikh activist Hardeep Singh Nijjar. Canada believes that agents of the Indian government were involved in Nijjar's killing. In Ottawa, Senator Kim Pate and MP Leah Gazan spoke on the Hill this morning. They're calling on the government to develop a framework for a guaranteed livable basic income for Canadians. They say the program is needed to address poverty and the other societal issues it creates, including violence.
We know currently in the country, our social safety net is not looking after people. We need to take radical action if we want to eradicate poverty. And we know there's a direct correlation between poverty and violence.
Gazan and Pate are pursuing legislation in both the Commons and the Senate. And politicians and Christian faith leaders gathered at the Shaw Centre this morning for the National Prayer Breakfast in Ottawa. The annual event, officially sanctioned by the Speakers of the House and the Senate, aims to build nonpartisan relationships through a shared faith in God. Prime Minister Justin Trudeau and the Conservative leader Pierre Poilievre were both in attendance. Well, to a New York City court now, where Donald Trump was forced to listen to testimony today from Stormy Daniels. An adult film star, Daniels was allegedly paid $130,000 to keep quiet about an affair she claims she had with Donald Trump. An affair that took place before he was president, and one that she described in explicit detail in a criminal case against the former U.S. president today. Well, with more on the testimony and the trial itself, we're now joined by David Levinthal, editor-in-chief with Raw Story. Dave, good to see you. Thank you for being here.
My pleasure, Michael. Thank you.
So listen, I think it's good for us to begin with a reminder, especially for a Canadian audience, of what U.S. prosecutors are trying to prove with this trial. What law has Donald Trump allegedly broken here?
There are 34 counts that Donald Trump is on trial for, and it's all about falsification of business records. Now, on one hand, that sounds pretty boring, almost white bread, but on the other hand, it's about as salacious underlying as you can possibly get. And what we had today was testimony from Stormy Daniels, the adult film star who says that she had a sexual encounter, an affair with Donald Trump. She was testifying in rather graphic terms about her encounter with Donald Trump. And really the crux of all of this is, did Donald Trump try to pay Stormy Daniels off, and knowingly and willfully doing that in order to basically hush Stormy Daniels up so that she would not, or the story of this encounter that is alleged, would not ruin his 2016 presidential campaign? Big question right now that is an open one in court.
Yeah, a big question, as you say. But, you know, Donald Trump, it's interesting because he began by denying the affair altogether. But it seems now he's transitioned to just denying any involvement in any payment to Stormy Daniels. Talk to us about his evolving defense here.
Well, Donald Trump, as we all well know, will evolve in his defense of lots of different things, or his views on different things. He can hold sometimes multiple positions at the same time in terms of policy, or in this case, his personal life. So as a result, it does seem that he is moving away from that longtime denial that he never had anything to do with Stormy Daniels in a sexual way or otherwise, but the testimony that she is giving under oath would directly contradict that and has directly contradicted that. So unless Donald Trump comes out in this week and says, hey, I'm sticking to my guns, none of this ever happened, this is all a ruse, this is all false news, then it does seem to be that this encounter did take place, and ultimately Stormy Daniels is going to continue testifying and until she's done, which we'll see if she's still on the stand later this week.
Now, and interestingly, with what she has been providing today, at least, there were moments of her testimony that were very explicit, and I know that Donald Trump's defense had issue with that, but I'm wondering why prosecutors decided to go there, because at some point there seemed to be even some question as to how consensual their encounter was.
Yeah, well, first of all, prosecutors have, in essence, more or less acknowledged that Stormy Daniels will take liberties in the way that she talks, and she's not necessarily a witness who's the easiest to control, if you will. But Stormy Daniels did talk in very graphic terms. There was coaching from the judge basically saying, look, there are certain things that we don't want to discuss here today, the most graphic details of this encounter. Stick to what you are asked. Stick to the questions that are being posed to you. Answer those questions, and don't freelance too much, more or less, is what was being said there.
Yeah, and certainly a lot of eyebrows raised. But, you know, before we're done here, I have to ask, how is this affecting Trump's campaign to be reelected this fall? Because at the very least, he's required to sit through all of this trial right now.
Yeah, and prosecutors put Stormy Daniels up on the witness stand to basically prove that there was motive and intent for Donald Trump to hush Stormy Daniels up, to pay her off, and to not have this information get out there, not just for his family or the sake of Melania Trump, his wife, but for the sake of his campaign. So flash forward 8 years from 2016 to 2024. The question of how is this going to affect his campaign? I think the easy answer, Michael, is that immediately it's not, at least in the eyes of his most hardcore supporters. It doesn't matter what Donald Trump does, they are going to stick with him. The question remains about those voters, however, who are on the margins. Those independent voters, the very few voters in this country who are truly, genuinely undecided, or the voters who might be on the fence in 8, 9, 10 key swing states in the country, places like Pennsylvania and Wisconsin and Arizona, the states that are ultimately going to decide the fate of the 2024 election between Donald Trump and Joe Biden. So, you know, stay tuned to this case, but also, too, let's remember there are 88 felony counts overall that Donald Trump is facing. 4 different criminal cases. This is just the first. There may be others that ultimately come and spool up prior to Election Day, and that's a big variable and unknown at this point, Michael.
Okay, well, of course, that means we're going to call you again in future, Dave. But for now, thank you for this. David Levinthal in Washington, D.C.
Thank you, Michael.
And that is our program for this Tuesday. For everyone here at CPAC, thank you for watching. I'm Michael Serapio. Primetime Politics is back tomorrow night. Until then, take care.